Groski, and I'm the Communications Chair of IPAC Manitoba. This event is Gendered Impacts of COVID-19, which is a very timely event and promises to be one of our most engaging sessions. In fact, it's one of our most popular events, so popular that we had to expand our Zoom event, which means that the link has changed, and we hope that everyone has received the notice this morning. Special thanks to Angela Colambage and Melissa Taves for their assistance with planning this event. Before we begin, I'd like to do our land acknowledgement. IPAC Manitoba is located on the ancestral lands of the Anishinaabe, Ininiwak, Anishinaabe, Dakota, and Dene, and on the homeland of the Métis. We acknowledge the distinct histories of the 7 numbered treaties that apply on this land. We recognize that public administration and public policy have been used as tools of colonialism and the harm this has caused Indigenous people. We are committed to promoting public administration in a way that advances reconciliation in a spirit of collaboration with Indigenous people and communities. For those who might not know, IPAC Manitoba is the Institute of Public Administration of Canada, a not-for-profit group of public administrators who host events like this and recognize excellence in public service. We usually also host networking events, but that's been a challenge during this pandemic. This event is being recorded for viewing on IPAC National's YouTube page at a later date. Audience members are muted by default, but you're welcome to ask questions in the chat box below. Now for our list of expert panelists. Jessica De Silva is the VP of Diversity for the Institute for International Women's Rights of Manitoba. Next is Angie Hutchinson, Indigenous Knowledge and Equity Specialist for Mama Wichita Center. Then there's Karen Sharma, who's the Assistant Executive Director of the Manitoba Human Rights Commission. And then there's also Marcie Wood, who's the Executive Director of Willow Place. Moderating today's event is Jen Zoratti, who is a journalist with the Winnipeg Free Press. Without further ado, here's Jen to get this important discussion started off.
Guess I should take myself off mute. Welcome, everybody. I'm so excited to be moderating today's discussion. I think it's really timely. I think it's really important. And so I'm not going to waste a bunch of time talking. We want to hear from our expert panelists. So I think the format is going to be, we'll let all our panelists talk for a few minutes, and then we'll have a conversation. And I think some of the things that we want to talk about are, I mean, obviously we know that it's the gendered impacts of the pandemic, but I think in addition to talking about some of the problems and challenges, I think we also want to discuss some ways forward. So why don't we begin with Karen?
Sure, thanks so much, Jen, and thanks to IPAC Manitoba for holding this important session on the impacts of COVID-19 through a gender-based lens, and to you for facilitating this session. Thank you so much. So I want to begin just by highlighting a few fundamental issues that, at least from the Human Rights Commission's perspective, we think are important when thinking through COVID-19 through a gendered lens. Over the past 9+ months that we've been experiencing COVID-19 in Manitoba, we've really noted that COVID-19 is exposing structural inequities and deep divides within our communities. And we're recognizing that what gains we've made with respect to equity are truly at risk of being lost, not as a result of COVID-19 in and of itself, and I think this is really important, but rather through the management and response to COVID-19. So it's the way in which we're responding to this pandemic that is leaving folks behind and resulting in deepening divides with respect to equity, not simply the disease itself. Across Canada, we know that in the first couple of months of COVID-19, 1.5 million women, Canadian women, lost their jobs in the first couple of months of this pandemic. That is a staggering number, and it's the lowest employment rates for women in 3 decades in our nation. That's significant, and we're knowing that as certain industries started to reopen, unemployment rates did not better or increased for women. In fact, they were being rehired or reintegrating into the economy at a slower rate than their male counterparts. We also know that there's been a surge in domestic and intimate partner violence and family violence as a result of the pandemic, that the kinds of public health responses to the pandemic, or measures that we're all meant to practice, so physical distancing, keeping within our households, staying home as much as possible, are not things that we can all equitably practice safely within our homes and family structures. And this type of violence disproportionately impacts women and girls. But also, I think it's important to note that it puts transgender youth at risk. And we know that in terms of homeless youth, 40% of homeless youth in Canada are transgender or LGBTQ youth. And that is really due to the transphobia and homophobia they experience in their homes. And so we also know, in terms of gendered impacts, this is going to have a disproportionate impact on our trans community, in particular trans youth. And that's significant and not something that we necessarily talk about all of the time or have on the forefront. I also think we have to highlight that the pandemic is having a significant burden, or placing significant burdens on women, in particular Black, Indigenous women of color, who are disproportionately providing care in so many ways, but also through, more precarious health occupations, for example, as healthcare aides, dietary aides, personal support workers, where we know Black, Indigenous women of color are disproportionately represented in those occupations. And furthermore, we just know in general that BIPOC communities are disproportionately being impacted by COVID-19. If we look at numbers from other jurisdictions, higher rates of BIPOC individuals are, experiencing COVID-19, and also the impacts are more pronounced. Our data in Manitoba, with respect to the First Nations experience, highlights this quite brutally. We have 20% on reserve test positivity rate for First Nations people in Manitoba, with an 18% test positivity rate off reserve. We know 40% of ICU patients in Manitoba are First Nations. 12% of our overall deaths in Manitoba have been amongst First Nations people. And we knew before COVID-19 emerged in Manitoba that it was going to have these kinds of disproportionate impacts through our experiences of past pandemics like H1N1, and yet we haven't taken the necessary steps in order to safeguard our communities. And the kinds of steps we're taking, which are extremely individualized, are not responsive enough to address these equity gaps. And I think that's really well represented in our most recent sort of tragic passing of Jen Garson Sinclair, who was in her 30s, a member of Fisher River Cree Nation, who passed as a result of COVID-19 after already having survived H1N1. So we know that COVID-19 is not being felt equally in our communities, and the responses to COVID-19 are not being distributed equally. So a few opening thoughts, and I'll pass it over to my next panelist.
Thank you, Karen. Let's hear from Jessica next.
Hi, everyone. Thank you so much for inviting me, and thank you, IPAC Manitoba, for giving us the space to talk about this important issue. And thank you for all of you that are here today with us. Thank you, Karen, for all your thoughts and all your perspectives. They're so important. As you mentioned, we need to highlight that COVID-19 and the measure being implemented to contain the virus are deeply affecting social and economic relationships in Manitoba and beyond. The curtain has been lifted, and we are now seeing the emphasis on what we deem as essential services. The most precarious, low-paid occupations such as caregiving, food, and delivery services that were once dismissed and accounted for are actually vital to how our system works. The overdue recognition of this important work has yet to be accompanied by the financial compensation these workers deserve. As we all know, the financial stresses are not only impacting the province on a large scale, They're exacerbating the already established high risk of sexualized violence towards two-spirit and non-binary people, women, and girls, with reports of increased domestic violence, sex trafficking, sexual harassment, and coercion by landlords, as well as violence towards community members who are Indigenous, Black, and people of color, and two-spirit LGBTQI people. The status quo is not good enough, and we should not return to normal. The COVID-19 response and recovery plan are an opportunity to rebuild the economy better than before, with an emphasis on addressing the gaps that have come to light or that have always been in existence and not recognized as gaps in healthcare, childcare, education, affordable housing, public transit, and gender-based violence resources. It's not only important to look at the impacts of these key areas, it is also vital to hear the recommendation of those who lived experience. Recovery stimulus funds are supposed to be neutral, but we know it's not possible in a gender society without a thoughtful intersectional feminist plan. Upon building a caring economy out of unsuccessful capitalist systems, it is important to address systemic issues that need dismantling, repair, and rebuilding. These issues include gender-based violence, economic insecurity, poverty, ableism, and racism. As such, in our work at Institute for International Human Rights, we've been asking and actually demanding for an intersectional feminist anti-racism women leadership that must be in the center of the COVID-19 response and the recovery plan. It is time for us to unpack and diversify our economy and social structures and institutions to include those that are being affected the most with this pandemic and that were already being affected the most with the current system. So thank you. I will pass it on to the next.
Thank you so much, Jessica. Let's hear from Angie next.
Hello, everyone. Thank you for having me participate in this panel today. So my words are actually going to echo a lot of what the previous panelists have already spoken to, that this pandemic has not only underscored but magnified existing structural inequalities. And that needs to be brought to the forefront. There is issues that go beyond the current health crisis that we're facing, but it needs to have an emphasis on those structural inequalities that already existed and that continue to be magnified throughout this pandemic. When we look at that intersectional approach of how race, gender, class, poverty, housing, other social determinants of health are impacting individuals throughout this pandemic and the pandemic response, we see that these inequalities are interconnected and layered and structurally built into systems. And so again, turning back to those areas where we see greatest impact around access to, safe and stable housing, access to economic recovery as far as job loss. We look at those sectors that have been most impacted around those precariously housed. And we really need to apply that distinction-based response. So there's been a lot of talk about economic recovery. And I think we need to go beyond economic recovery and really talk about how do we look at cultural and societal re-envisioning, because this has highlighted that there is significant disparities for specific groups of individuals. And we have an opportunity to make real meaningful change in this moment. We've seen that within that kind of initial crisis response, we've seen huge response policy shifts that have been implemented by various levels of government. So that demonstrates that there is possibility to have those systems change within this current moment in time. And we can use that in a way that we start to move the bar when it comes to structural inequality for very, distinct individuals, those who are experiencing, extreme forms of oppression and marginalization, Black, Indigenous, people of color, gender diverse folks. We're all looking at how systems of inequality continue to not only cause harm outside of this pandemic, but exacerbate the harm that's happening as a result of some of the outcomes from the pandemic. And so really looking at how we move beyond just talking about an economic response, but really looking at how do we respond both culturally and societally and move those systems that continue to cause harms for specific individuals. Thank you.
Thank you, Angie. And Marcie.
Thank you so much. So we've had the opportunity to hear from some wonderful women in terms of the impact that this has had on women in terms of the disproportionate impact on women, as well as from the intersectional lens. I'm going to focus more so on this issue or this topic from a service delivery level, because all these ladies have been able to provide us with the information in terms of what we've faced, what we've seen from a service delivery perspective. So for those of you who don't know, Willow Place is the largest shelter for female identified and gender diverse folks in the province of Manitoba. We typically serve over 1,000 clients a year with over 10,000 bed nights. In our facility, or our residential services, we have a capacity to have up to 38 individuals at a time. So that's typically the person, and then if they have children as well. What we saw was definitely a decrease in those accessing services at the onset of the pandemic. We saw that decrease by approximately 40%. In April and May, and of course that's a concern for us, because what we knew is that those that are, as discussed already, in following restrictions, they're safe in self-isolation, they're not accessing resources in the same manner in which they normally would. And as a result of that, we needed to relook at what we would do to be able to reach those people, because our fear is that they're remaining in unsafe situations for far longer than they normally would. So what that really looked like was that we saw an actual decrease in those accessing requests for residential services and also crisis line calls by approximately 50%. However, what we did see was an increase in individuals accessing our outreach services, meaning accessing counseling through, at that point in time was through phone counseling. So our caseloads there went up from 2.5 per counselor to about 5. So we knew that people were wanting to access services, but having to try to find it to do it in a different way. So one of the first things that we did was we developed a text line so that people could find safer ways to be able to access our services if making phone calls wasn't doable. We actually seen it was a slow uptake in May and June, from April, May, and June. However, in July, we saw it spike, and actually to date, we have almost 2,000 text messages. So there has been a significant uptake with that. And we're happy to be able to provide that service, and something that we plan to maintain in the long term. We also had to make sure that people knew that they could come to shelter and feel safe, that shelter was a safe place, not only because of what they were experiencing in their lives, but of course, in terms of the pandemic. So what we did is we took a step back, and we actually, even before the official pandemic was announced, we had begun to look at what processes and protocols do we need to be put in place at Willow Place to make sure that the environment would be as safe as it could for everybody. And we feel that we're very confident that we were able to do that, but we also needed to let the community know this. So we undertook, in coordination with the Manitoba Association of Women's Shelters, a public awareness campaign to be able to ensure that the community was aware of what we were doing to ensure their safety across the board. We also had to, as time went on, we saw the initial decrease. What we actually saw was a spike in July in terms of those needing to access services. So once we returned to what was normal at the time, we saw that those that were maybe holding up for long periods of time actually then needed to reach out and access those services. So since then, we have been in a place where we've been near at capacity most of the time. We're definitely stretched in terms of what we're able to provide. And in more recent weeks, we've actually begun to look at contingency planning of what we can do when we are at full, as travel is not encouraged across regions. So what can we do to provide extra beds within the city of Winnipeg in the event that Willow Place and or our sister shelter, IPAC, is full. So I'm happy to say that we have come up with a contingency plan that is currently just being rolled out. And I'm hoping that that will provide safe alternatives for everybody in the upcoming months. Thank you.
Thank you. So clearly a lot of knowledge and a lot of experience here, and a lot to talk about. So I think we should dive in. I was reading, and this kind of speaks to what everyone has talked to, but I was reading a piece by an author named Anne Helen Peterson about how other countries have social safety nets. The US has women. So basically talking about how in the US, and I think it's true of Canada too, that women have emerged as this unofficial safety net to many, and when I say women, I include, women identifying with, like, across the board, have had to pick up the slack that they shouldn't have to, right? A lot has been put on women of all ages, women of all abilities, women of all colors, and in particular, I think, women who are mothers. So whatever that looks like, whether, because mothers come in lots of forms as well. So I want to talk about that and just sort of why do we think, panelists, that it always seems to fall on women and and people who identify as women? And then I have a follow-up to that question. I'm going to pick on Karen to start.
I think you're quite right that this isn't just a phenomenon that we're seeing in the States, although, that writer is speaking about the US experience. It's absolutely something that we're seeing in Canada as well. Just a lack of planning, like contingency planning or thoughtfulness around who educates the children when we close down schools, or who provides care to family members when they're sick. I think we know that that labor is falling to women, and it's it's kind of labor that's not recognized or provided the sort of respect or from an economic perspective, et cetera. And we know that because women are re-entering the labor force at slower rates than others. And I think that has to do with the fact that they are still, the burden of care for their children, for community, for the elderly is falling to them. So for me, why do I think that that's happening, and why is this phenomena so prevalent? I think it comes back to something that feminists have been trying to center for years, which is just the lack of recognition and lack of respect for the labor of mothering and parenting, and the way in which this labor has never been centered or afforded the kind of respect that it ought to be, and that in fact, if anything, it results in inequities for women, right? And I think that I certainly have fears that when it comes to re-entry into the labor force for women and caregivers who've had to take time away, it's going to be even more difficult, and that there will be, gaps in employment histories for folks that will make it difficult for them to re-enter the labor force, that it will affect wage progression, et cetera. And I think that that's something that we know has happened to women throughout history since, and we've always been in the labor force, but just in ways that folks haven't wanted to recognize. So those are my 2 cents. Yeah.
I think that's a great point. And I kind of maybe naively thought that because that this was happening, that it's like, oh, maybe it took a pandemic to get people to recognize the unpaid constant labor of women. And yet it hasn't. So who else would like to speak to this? Maybe, I don't know, Jessica, do you have any thoughts on about why women are sort of the unofficial safety net?
Yeah, sure. I think there's historically, women has always been used when needed. When we think of a war, that when women came to become a labor force and they had to work and they start working industry that before was only male dominated, because they need women to do so. Once that need wasn't there anymore, go back to the household. You're the mother, you're the responsible to be the caregiver, to provide that foundation to the children and all that. And it all comes back to the gender role that we have. Women are supposed to be mothers. Women are supposed to be the caring of the relationship. They're supposed to have everything organized. They're supposed to know where everything are. They're supposed to make sure that the kids are well fed, well taken care of. And not only that, the husbands are well fed, taken care of. The family, when you're thinking about the in-laws, the person that take care is not going to be the husband or the son. It's going to be the wife and the mom, the daughter-in-law that's going to take care of the in-laws if there is any issue, there's no one else to do so. So it's all about ensuring that women know its place as you, first and foremost, you're a mother. First and foremost, you're supposed to care for others, and whatever that you want to be after that or with that, it doesn't matter. It's not important because that's not your role. So you see reflected in this safety net, in this women rising to front lines and carrying the majority of the workload. And as we know, there is this third shift that women have to partake. You have your job, you are a professional, you're a wife, you're a mother, and that is not recognized as being labor. That is not recognized as being, and it should be paid work. The amount of work that we go through in the households, that we have to make sure that everything is it's organized and everything is running. It is work, and it should be paid for. We should have the recognition of the amount of responsibility that we carry. And my last point is I started watching this Working Moms TV show, which I'm loving it. But it's interesting that one of the characters of the family, the couple, the woman, she writes like this to-do list, and in her list, like her and her husband, she has like 10 items, and her husband just has 3. And it's things about bathe tonight, make sure that the dog is fed. And she has all the other items related to household, taking care of the children. And for him, it's just like those 3-4 items that he has to do. That's not even related to household or even taking care of the children. So it's even interesting to see even progressive couples, how this gender role is still placed and such a relevance and influences a lot how we create our relationships and marriage and all that. Thank you.
Angie or Marcie, any thoughts on that? Anyone can jump in at any time. You don't have to. I don't have to call me.
Yeah, I'll just build on kind of what already has been spoken to. When we talk about kind of those gender roles, what we're really talking about is gender privilege, which translates to, how patriarchy has been embedded into our systems yet again. So if we look at kind of what has been the historical positioning of what we determine as our, consumerist economy, it's really been based on, males and male identifying folks being the breadwinners, and anyone else outside of that is deemed unessential, and the work that is deemed outside of that commodified services is unessential, and so is not valued. And so again, looking back at how we kind of revision these systems that have been really kind of baked into our society, this is one of those things that can be brought into that conversation and brought into the forefront, how this pandemic response has really highlighted gender privilege, in particular within the economy.
Yeah, great point.
Just to build on what Angie has said, it's something that we see as we know that women being disproportionately disproportionately affected by gender-based violence, one of the things that is most common prior to the pandemic, but certainly throughout it as well, is the fact that typically the victim is the one that needs to leave, whether she's leaving because she's unsafe and she's choosing to leave, or whether there's police involvement. So the fact that the victim always needs to leave the situation is that has an impact as well, because she's typically bringing along the children as well, because they're usually in her care, or her children, meaning they might not be the perpetrator's children as well. And so what we've seen as a result of that is certainly an increase in children throughout the last 6 months, which is something that we haven't seen in previous years. So I would say that that would be a direct result of the pandemic as well.
Absolutely. And I think kind of what we've been talking about all along, about all the things that the pandemic has exposed, I think they're things that we've all been just screaming about forever, you know, and now it's, you know, and there's been so many pieces written by people too, being like, why is no one listening to us? Whether they're teachers, whether they're nurses, whether they're mothers, like, it's just, why is no one listening? I want to talk about working, because as Karen was mentioning, and as most of us know, women have been forced to leave the workforce in droves during this pandemic. And this is a phenomenon that we're seeing all over the world. People ending up, you know, having to quit their jobs, having to quit careers that they've worked really hard for, because they are now homeschooling and teaching a million things, right? My question for the group is, why is that a problem? We need to talk about, like, why do we not want to see this happen? And why is it bad for the economy? Since the economy seems to be where everybody's focus is. But why is this bad? And maybe we'll start with Angie.
Yeah, thank you. There's a number of different ways that we can kind of view this. We already know that, you know, women identifying folks typically will earn less within their life period based on that gender gap within wages. We know that typically women identifying folks tend to live longer, and so they're also accessing more additional social supports in the later on in life. So we're looking at income supports provided through, you know, federal systems of social insurance and things along that line. And then additionally, now we're seeing, because of this gap in employment that's occurred as a result of the pandemic, those folks who do have access to pensionable income is also going to be losing out in that way. And so then again, we're looking at kind of the longitudinal impacts beyond just, you know, this, you know, whatever this be, 8 months to 18 months or 24 months, whatever that looks like. This is going to have far-reaching effects beyond the time that we're kind of framing it within as far as an economic recovery. This is going to have longer-term impacts as far-reaching into the future. And then in addition to those kind of initial economic impacts as far as employment, we're also looking at the mental health challenges that this is experiencing. And so we actually have no idea what those long-term mental health impacts are going to be for folks, and what does that recovery look like as far as once, you know, women identifying folks are able to return to the workforce. As Karen mentioned, is there going to be jobs available for them? Are they going to be experiencing continuing mental health experiences and symptoms as a result of kind of this global trauma that we're all experiencing? This has been trying for many different folks in many different ways. And so we actually don't have an idea what those long-term impacts are going to be. But outside of just kind of the immediate economic response, there is a longer-term response as far as how do we see that transition back into the workforce. And is there going to be, you know, opportunities to return to the similar types of position? Is there going to be opportunities for, you know, up-leveling and training to be able to expand those economic possibilities? Again, all things that easily could have been done beforehand. We already know that there's a huge gender gap in wages. So is this going to be an opportunity for, you know, government responses to actually make impactful change when it comes to those already existing gaps that we know about and we have the data on. We actually don't need to do any studies. We don't need to do any research. We already know this. We can just make a plan and start to implement that plan. Thank you.
Thank you. Anyone else want to dive in on that?
I would jump in. It's Karen here. Just to add to what Angie was stating, absolutely, I think that we have to think about the long-term impacts of what this kind of interruption to women-identified folks' work trajectory and careers represents for them. But in addition to that, I think that it's important to bring an intersectional lens to the patterns of unemployment that we're seeing throughout this pandemic. And there's some data that we don't know yet, but I think anecdotally what we know, and because of what we knew prior to going into the pandemic, is that the rates of unemployment are not going to impact women consistently or in the same ways across a number of different social categories, and for example, across racial difference, across economic difference, et cetera. And I think we have to think about the ways that this pandemic, further exacerbated the racialization of certain areas of our economy. So the ways in which BIPOC women, Black, Indigenous women of color disproportionately work in specific industries, often industries that are precarious, low paying, and have fewer, safety nets or benefits and insurance schemes, et cetera. And how women of color are also bearing the burden of healthcare of the provision of healthcare in this pandemic, and in ways that are also precarious, right? Like it's, we know that there are a huge number of women of color working as healthcare aides, as dietary aides, as personal support workers, which, are lesser paying jobs in the healthcare sector and have more precarity attached to them. So I think, when we talk about unemployment and the interruptions to the experiences of women in the workforce, it's important to think about it both through a gender-based lens, but also through an intersectional lens, because those experiences are not being equally felt by women of different races and economic statuses.
Absolutely. Thank you so much. I want to talk about and this we'll maybe start with Marcie. The shadow pandemic that's happening in addition to this pandemic, which is the domestic violence piece. I think that's something, we talk about the privilege associated with being able to follow certain public health orders. Sheltering in place is certainly one of them, especially if you are in a relationship that is abusive. So what's the way forward? How can we, I guess, societally better support people who are in those situations, and how do we talk about them? Because I also feel like this is something that a lot of people aren't thinking about. So maybe Marcie, we'll start with you.
Thank you, Jennifer. I thanks for that, because I think that that's something that we definitely need. Again, it's one of the things that the pandemic is highlighting, something that's always been there, but something that should have been talked about. I think that generally speaking, that gender-based violence and the impact that it has on women, especially from an intersectional lens, isn't something that's talked about often within our communities. It's talked about within certain sectors and in certain aspects of government, but it's not really something that we talk about in our communities. And as a result, many women identified individuals end up staying in situations that are unsafe because they don't know what to do. And quite often it could be the person sitting next to you in your office. And I think the reason for this is because we don't have, it's not talked about in a way, or enough education is shared in a way that it becomes talked about as often as homelessness or unemployment and mental health. And all of those things do impacts somebody who's being affected by gender-based violence. And so if anything, I would like to see that come out of this is that it's something that becomes a regular topic that people are aware of. They're aware of the dynamics. They can notice it in a friend, a coworker, a family member, so that individuals feel that they can reach out to people or reach out to people and offer that support and know what supports are available. And one of the things that Willow Place has been fortunate to be involved with is a project that was funded by Wage Canada. And just yesterday, a press release came out from the province of Manitoba because they have partnered with the project, which is called Challenge for Change, in providing training. The training actually came from the project, but there'll be spots available that the province has sponsored for service workers. So that doesn't mean that you're a domestic violence worker, but rather you could be a civil servant working in the public, have regular contact with the public, and maybe seeing things that you don't understand, but by participating in this training, you'll get the background information that you need to be able to provide support to that person who may be coming to your counter or, meeting with you in an office, so on and so forth, so that you have that tangible information to actually put into practice and hopefully help support victims.
That's great. It's always nice when you can hear about something that's like practical and tangible and putting into practice. Do any of our other panelists have thoughts about the domestic violence piece of this and what we can do to better help, better support, better understand? Angie, I see you coming off mute.
Yeah, so Marcie spoke to it very well. I just want to add on to what she's already spoken to is the support that's needed for those working in the sector. So this past 8 months has been trying for everyone, but the sector, the anti-violence sector, it is very draining. It can be very taxing work on any given day, and so to the added pressures that come with this pandemic, all the things that we talked about, you're struggling to balance childcare and schooling and care for loved ones, and then you're coming into work and there's all sorts of additional challenges as far as like, how do we continue to provide safe services and alterations of services and policies that change every day with different PPE orders, and that's all constantly shifting and constantly changing. And it's just incredibly taxing on the folks who are working in this sector. And so right now, I think we're also at a point where we really need to look at how do we provide ongoing continuing wellness for those who are working in the sector, or will be facing another extreme pandemic when it comes to burnout within the sector. So I would just add that on as well.
Yeah, that's a great point. I think burnout was another thing I wanted to talk about in this discussion, because I think that is a problem, right? And I think it's when we talk about sort of the long game. I mean, I think we thought of it as a short game for a long time, and now we're kind of looking at it further beyond. Burnout's a big thing. So if you're working in healthcare, if you're supporting, survivors of domestic violence, if you're, there's so many ways to be burned out in this experience that we're all experiencing together. So with respect to burnout, what are some ways that we can talk about burnout and look at addressing burnout? And spoiler, I don't think it's about individual, and I don't think it's about bubble baths or face masks. I think it's collective. So let's talk about collective action versus individual action in terms of addressing burnout, but also in terms of addressing some of the things we've brought up. Whoever wants to start can go for it. Oh, you're gonna make me pick one of you.
I can just kind of throw a thought out there, and hopefully others will pick up on things. It's very similar to what Marcie spoke about. We need to have ongoing public, private, social conversations, not only around domestic violence, but around mental health and mental wellness. every single person on this entire planet has a spectrum of mental health and mental wellness that we don't talk about as a pretty broad statement. We don't talk about mental health and mental wellness. And I think that this pandemic has highlighted the fact that we really don't talk about it. There is a lot of folks who are experiencing the challenges around isolation, the challenges around the anxieties, and we don't talk about it. And we actually don't have very good support systems in place for folks who are experiencing challenges when it comes to their mental health and mental wellness. You know, even if you just, we need to go beyond just like, you know, having a conversation, touch base with a friend, which is great, that can help in, you know, to get us through those little bumps. But when mental health becomes a real challenge, we need the support services in place, and we need to have equitable access to that. So if you are employed and you have a private insurer and you can access supports through that, that's great, but that's not the experience of many different people. And so we really need to look at how do we prioritize mental health and mental wellness as embedded social structure within, you know, across society. So I'll just let others pick up on that.
I'll add, it's Karen here, that you know, I think it's important to recognize that much of the burnout that those of us that are working in sectors that are, you know, either support, you know, doing anti-violence work or working in community health or, you know, other kinds of support agencies, much of the burnout we're feeling is because of the deep inequities in our society. You know, we are doing double time work to support folks because of the barriers that they face in accessing supports and services on broader levels, or you know, the double time work that we have to do to create programs or structures that assist people through what are, you know, racist systems or colonial systems. And I think it's really important that if we want to think about burnout in the long term, we have to tackle inequity, right? Because we just are going to keep falling into a pattern of working as hard as we can to support folks and coming up against these, you know, the wall of like deep exhaustion over and over again because of how deep the divides in our province really are. So just I absolutely agree that we have to think more about centering mental health and wellness in the everyday, and also you know, knowing that much of as a racialized person, I can say that, you know, a lot of mental health challenges arise from deep structural divides and arise through encountering racist or colonial structures. So, and are, you know, the result of intergenerational experiences with those structures. So I think it has to be such a multi-pronged approach, but that centers an equity-based approach, you know, at its heart.
Any other thoughts about burnout and how we move forward before we move on?
I think it's important for us to recognize the power of vulnerability, letting yourself being vulnerable, and even in the workplace, when we're talking about the inequities that we've been fighting and we've been talking about them for so long. When people say that COVID has exacerbated, has brought to the front that there's inequalities, like, to whom? We've been talking about them for a long time. We've been fighting. We've been going to the streets. We've been trying to get the support from the politicians, for those in power, to address this inequalities that we're talking about now. But it also needs to talk about capitalism. There's this whole system, economic system that we are in right now, that demands for productivity, demands for you to be always on the go all the time. So we need to restructure how our workforce and how our work environment is, that for top to bottom, to allow conversations like Angie and Karen was mentioning about mental health, mental illness, to allow those conversations, that we feel comfortable enough to be vulnerable and to say, yes, it's not okay, and how can we together collectively find a better way, a better path. If we don't address this capitalist system that is not working, as we all know, and try to find a way in which it is actable, it's just, in which all the voices are being included, and bring to our workplace and our work environment indigenous knowledge on how we can conduct a more balanced, a healthier relationship with our work, with our co-workers, and with our personal, professional, and all the relationships that we have in our lives.
I think that was very well said. And I think it's a good segue into something, and then we want to open it up if any participants have questions. But there's been a lot of talk about the new normal, which has become one of those phrases of the pandemic. But I think this is such a time to really evaluate what's not working. And so much is not working about our system, whether we're talking about capitalism, whether we're talking about the division of labor at home, whether we're talking about the value of the work of care, whether we're talking about it's all well and good to follow the advice, stay home when you're sick, unless you've been socialized to believe that taking a sick day makes you a bad employee. You know what I mean? There's so many things that don't work. So I would like to get each of our panelists, speaking to your specific spheres of expertise, what you hope for a new normal and what that could look like if we were able to, burn this all down and architect something new. What does that look like? And I'm going to start with Marcie.
I think my hope would be to continue to receive the attention that we're receiving in terms of the work that's done and the issue of gender-based violence in particular. I think that since the onset of the pandemic, it has been highlighted consistently, which on one hand is not great, but on the other hand, it's fantastic to finally have that be highlighted consistently throughout that time, to be asked questions, to be in the media, the attention that we're receiving from our funders as well in terms of what do we need to do our jobs better, what services do we need to implement. So I think that if you were to ask me, it would be the hope that that continues and that we're able to then expand our services and be able to be funded appropriately, to be able to do them to do what we're doing, but with not the fear of how are we going to afford that next year.
Visions for a new normal. Who would like to go next? I'm going to pick someone. Angie.
I think for me, my hope is that there would be a critical reflection on what we deem as normal, and how all the things that we talked about today, as far as race privilege, class privilege, gender privilege, how those are embedded within systems of economy and society, and kind of what is deemed as normal. So when I think about kind of that re-envisioning, normal is not the word that I would use, but I would look towards that balance and equanimity as being part of those revisioning of structures. Right now, we're looking at systems that are extremely unbalanced, and power and privilege is placed in very specific pockets. And so I would look to a re-envisioning of balance and equanimity as my vision for the future.
Maybe Jessica next.
Yes. When we think about this last month, and we saw the community coming together, when we're thinking about the marches that we have for Black Lives Matter, and the community actually showing speak out and coming and supporting each other, I feel that's what we need more. We need to more empathy. We need to understand that that I, with my agency, I have the responsibility to empower others. to help others find their own agency so they can have actually the voices to speak, the voices, the spaces to speak. And we cannot expect for those in power to make the systemic changes that we need. We as part of the women movement, we need to come together to just dismantle the silos that exist in the women's movement as well, and come together more united, louder than ever, to ensure that we're pushing the demands and we're pressuring those in power to make the changes that we need. It's time for us to move towards a transformative approach rather than just a performative approach. Whereas we see Trudeau goes to the TV and he says he apologizes and he says it's going to do different, but that's just a performance. It's just for him to continue in power. So what can we do to ensure that they're doing that we are moving towards that transformative and not only that performative? So I do believe that we cannot lose the momentum that we have in coming together, the support that we got from our funders, from the community at large, and so we can actually shift that to a caring economy, a caring society that is for everyone and with everyone.
And Karen.
Well, a new normal. Such a big question in a way, because I think that what we, what we're experiencing now is a greater level of dysfunction and, a situation I hope will not become our new normal, right? We're leaving folks out of our pandemic responses. We're, allowing structural divides to deepen. And so I hope that that we sort of reorient ourselves to something, Jessica, you mentioned, which is a more of an emphasis on communal care. Absolutely, there's an element of our COVID response that has to be about personal, the individual and personal responsibility, washing your hands, keeping distance from one another. But what we're not talking about is the parts of our COVID response that have to be about taking care of one another, taking care of people who are houseless, women who are experiencing violence, etc. So I hope that if we shift our approach and center rights and equity in our approach, that we come out of the pandemic without deeper divides, but with the hope is a more equitable society, a Manitoba that has more space for difference, more space and empathy for wellness and the health and well-being of people in their communities, and more space for women to be successful and for gender diverse folks to be successful, because I think the path that we're on right now is a really concerning one. So my new normal, I think, my hope for a normal or for a vision beyond the here and now is that.
That's great. I don't know if any of our participants have any questions, but I think you can send them to Michelle or me. Can they send them to me or just you? You can send them to Michelle if you have questions, and then she can send them to me and we can talk about them. Another question I had for the panelists, and I'm aware of the time, but talking about data and the gathering of it. So, and why it's important to gather socioeconomic diverse data about the pandemic's impacts, about who the virus is affecting also specifically. I feel like we're not seeing a lot of that, and I think it's important, and I want you to talk about why it's important to have a better socioeconomic picture of who this virus is affecting, how it's affecting them, all that stuff. And maybe we will start with, I don't know, who wants to start? Anyone can start. Karen, you look like you want to start.
Okay, sure. Well, I think we know that the pandemic, we've known historically that pandemics don't impact people in the same ways. this is not news to Manitoba. H1N1 showed us that most recently, but throughout time, pandemics impact communities in disproportionate ways along racial lines, along gender lines, along economic lines, etc. So the reason we need good data is because we know that, and we need to cater our responses so that they meet people's needs in those ways, so that we understand what are the impacts, who's being hit by the virus and disease, who also is being hardest hit. So it's not solely about who's coming into contact with COVID, but also then what the impact of COVID is looking like along racial lines. And absolutely, I think data has been a bit of an issue in the Manitoba context. I mean, we certainly get some data, but we're not getting the depth of impacts or data on it in terms of socioeconomic impacts in the ways that we need to be able to cater our responses so that we can be responsive, right? And I think that's a real challenge. So we don't know how we know about the rate of COVID with respect to gender, but we don't know, how is it impacting people on an age-based level in a concrete way. We don't know about things like economic status and COVID-19. We haven't yet released data on race and ethnicity in this province, even though we've been collecting it, which is a huge issue, because then we can't tell you what the impacts are like for BIPOC communities in Manitoba. So data is so central to being able to cater our responses in appropriate ways. And if we don't have it, then it's very easy to take an approach that says, oh, it's just about each individual washing their hands, and we're not thinking about on a communal and collective level what we need to be doing.
Anyone else want to weigh in on that? The question again was data and why it's important to have a wide cross-section of information so that we are able to respond accordingly.
I would just add on to everything that Karen has shared. Absolutely, that data is important, but the lack of having that data shouldn't stop us from responding in the areas that we already know that these inequalities exist. We might not have that specific correlation between COVID and those experiences, but we have lots of data already on how specific groups of individuals experience marginalization within our society. So while we work on achieving that data related specifically to COVID, there is lots that we can already turn to help us immediately respond in that way. So, looking at, our audience here is mostly, folks within the civil service sector, the public service sector. Think outside of the box if you aren't getting the data that you think you may need in direct correlation to COVID and its impacts on specific groups. Be creative and go beyond kind of that initial direct line. We can look at lots of different areas that already already has data in relation to specific groups, and you can use that as part of your analysis. So don't let the kind of analysis paralysis happen. We can look at other ways of providing the data that's needed to support policy and policy shifts if we don't necessarily have that direct data related to COVID initially. Again, it is hopefully that will start to come out, but do not let that stop us in the meantime from responding in the areas that we need to.
Great. Yeah, that's such an important, I love that analysis paralysis, because I think that is something that definitely happens. We have a question. Do the panelists see us achieving any smaller doables coming out of the pandemic, like setting better care standards for personal care homes, better wages for essential care workers? I would say I would add childcare and better sick policy to that. But yeah, achieving smaller doables. What can we do? Maybe we'll start with Jessica.
I feel that we can achieve a lot in this time, as once I heard in one of my webinars, we should not let a good crisis go to waste. It's about us right now raising, as we mentioned, the inequities, the gaps that exist. It's not new to us, but it's new to a lot of people. So we cannot lose this momentum and continue raising their awareness towards education. The programs that we offer that would involve the community at large, that would involve those that need to unpack their own biases, need to unpack their own privilege. It's also, we need to talk to our MLAs, to our MPs, send letters. We need to make sure that our recommendations is there. We need to be present in the politics. So if you want to see the changes that we need to be there all the time. And support the causes that we know that is important, that we need to achieve those changes. We know that Canadians, they're ready for a system, for a better system in which prioritize the environment, prioritize human rights, social justice. When we see that 76% of Canadians are for a wealth tax, for example, we see there's like this shift in which we want to have those changes, and without the support of the large community, it's going to be hard for us to achieve them. So for us that we're like in the front line, for us that we provide programs, that we provide the services, reaching out to the community, I know that we're already doing that, but offering programs, offering training opportunities, professional development opportunities, having these conversations with our families, with our friends, those difficult conversations, for them to become allies in the movement and understanding what we're asking for.
Go ahead, Angie.
I think one of the changes that I'd like to see come out of us, this conversation is already kind of happening, is really looking at, it comes under many different names, guaranteed income or basic income. And we've really seen at the initial start of this pandemic that there is the ability of governments from across different sectors to be able to mobilize, to provide income, basic income for folks who need to have housing, who need to have, food security, all of those kind of really basic fundamentals, like human right fundamentals. And I think that it's my hope that those conversations that are already taking place around what does it look like for us as a Canadian society to be able to provide folks with the very basic fundamental income to be able to live in safe and stable housing and to be able to have food security. To me, that shouldn't be necessarily a debate. That should be something that we're all working towards. So that's something that I would like to see come out of this.
Well, and I like the way this question was phrased too, like the smaller doables, because I think sometimes when we talk about big systemic structural changes, some people are just like, oh, too big, can't, it's short circuit over. So yeah, really thinking about like things that we can put into practice, like 6 months, a year, 18 months from now. And again, it's like thinking about like, not just the short game and not just the really long game, but sort of that mid game. So other smaller doables. I don't know if our other panelists have anything to add on that, either Karen or Marcie. But
I was just going to really quickly add that, yeah, absolutely. I think that there are smaller doables that come out of this. But one thing that also became very clear, and I think the CERB was a really good example of this, is how quickly we can actually mobilize to create a big systemic change and structural change when we want to and when there's political will to do so. So I hope that one thing that does come out of this, it's sort of not a small thing, it's kind of a big thing, but that we actually shift our mindset in thinking that some of these entrenched systemic issues that are just, you know, unresolvable, we actually shift and think, well, actually, you know, they're probably resolvable, because if we can get guaranteed income and economic security to millions within a matter of weeks, we can probably, you know, address things like entrenched racism in our healthcare system, or the lack of accessible and available childcare for folks, etc. So I hope that we take that mindset out of this pandemic and into the future.
Absolutely. And I think we are nearing time. But any final thoughts, just to sort of close this out, if anyone wants to mention, add, say anything in addition to this conversation? No, nobody?
I'll just quickly say, well, first of all, thank you to IPAC Manitoba for inviting me, and to all my other fellow panelists, and for all the folks who tuned in to listen to our discussion today. Now, thank you. And I would just leave my final thoughts kind of echoing what Karen has spoken to already. Absolutely, it's really easy to point out all the challenges that we're facing, but we also have huge opportunities for change within this moment in time, and within, you know, that next, you know, year, 6 months, 15 years from now, we can shift the reality of where we are today to where we want to be. And that's what I would like folks to focus on, or to consider to focus on. So, Kineska, now, thank you for having me.
Thank you. Anyone else that have any final thoughts they want to share?
I would also just like to thank IPAC for having me, as well as my fellow panelists and everyone for participating. And just to build on kind of some of the final remarks that my co-panelists had, was I just want to support the idea of the mobilization and the ability for community to be a part of that. As Jessica mentioned, community can play a huge role in that, and community informs what needs to happen, and can help support that in a way that they may or may not realize, even for those small doables. And I think that there is, like Angie mentioned, there's a lot of opportunity for us to achieve small doables. A meeting I had this morning, that one came to light in terms of very small changes, structural changes that can have a long-term impact. So if anything, I just want to echo those sentiments and ensure that the community knows that there's a lot that they can do themselves to help keep us moving this along. Thank you.
I just also want to say thank you and add that absolutely, I think there's, you know, a real place for community-based organizations to be at the planning tables for you know, around our response to COVID-19, and to lend their knowledge and their incredible ability to you know, get creative and dynamic in terms of their responses to meet the needs of the communities that they serve. And I think that there's a lot of ability for those organizations and communities themselves to be part of the response and part of the design in terms of what we need to ensure that no one is left behind in this pandemic. So thank you so much. And it's been a pleasure to talk about equity and gender-based issues today.
Thank you so much. Sorry, I was kicked off there momentarily. Yeah, so I think that's it, unless there's anything else.
I do my quick thank you to all of you. This has been a fantastic event, and we're so grateful to all of our panelists and our moderator for offering your very valuable expertise. We hope that you've enjoyed our event and will consider attending more of our events. Just a reminder that this event was recorded, and should you want to refer back to it or share this important content with a colleague, we will be posting it to IPAC National's YouTube page. Discussions like this are an important part of developing evidence-based policies. It reminds me of the African proverb, if you want to go fast, go alone, but if you want to go far, go together. Have a great day, everyone. Thank you very much. Merci beaucoup. Miigwech.